Hi, everyone. Good morning. I think most of you know me, and for those who don't, I'm Monica Mitra. I direct the Lurie Institute for Disability Policy. I'm trying to figure out this mic. Okay, I'm going to hold it. And it's really my pleasure to welcome you to this afternoon's or this morning's presentations by our remarkable Lurie Research Fellows. As I was preparing my notes, I realized this is our eighth annual research presentation. So you guys are the eighth cohort, so really congratulations. So this fellowship, which started kind of with this brief conversation I actually had with Susan Buren and then the then Dean Weil approved it, and we just started this kind of a little bit on a lark, but really based on something that Dean Shostak and the former Lurie director, Susan Parrish, had created, which was a Rudiment Fellows program, which was also at the Lurie Institute. So we took that, we changed it around a little bit, and we went for it. And really, what was something that was such a I'm not going to say we put a lot of thought into it, honestly, but it has grown into this absolutely remarkable entity. And what's really, I think it's really the cornerstone of what's the best of Lurie, which is our real dedication and investment in mentoring the next generation of disability researchers, policymakers, practitioners. And so far, we've actually, there's been more than 45 students who've gone to this program. And I can tell you that they're doing absolutely amazing things, whether it's social work, whether it's medicine, whether it's public health, whether it's law. And in whatever they're doing, I know they're really taken and integrated the aspects of disability justice and law and justice and rights that they've been inculcated here. So I want to today celebrate the accomplishments of our remarkable, incredible fellows. Del Abney, Kearney Belvin, Ella Chase, Lauren Farley, Emma Ortman, and Vibhasha Roy. I know all of you have worked really hard, and you've done, whether it's on sexual reproductive health of youth and young adults with disabilities, positive parenting for people with intellectual and developmental disabilities, or examining the challenges of direct care workers in the United States. I know you've looked at administrative data, survey data, you've done interviews, you've done literature reviews, you've quoted interviews, really a wealth and a range of what constitutes research. And what's also incredible is that you have contributed to projects that are federally funded over multiple years and to something that's a lot larger and bigger than than your particular study. So I want to congratulate all of you on absolutely the astounding achievements and for going through this program. And I have no doubt that whatever you do after this, I know you will carry what you've learned from this program. I also want to say, please stay connected to your mentors, but also stay connected to the Lurie Institute, because we want to hear from you and we want to know what you're doing and how you're doing it. And we want you to come back and mentor our current students. But before I end, I want to, none of this would be possible without our mentors here. And I think you know that. And the kind of the investment that they put in, which is something that really all our mentors and everyone at Lurie actually wants to do. It is part of the culture. So I really want to thank Sid Pickern, who's joined us online. Kim Tay is also online. Miriam Hyman is right here. Lauren Bixby is online. Ilham Akorbishayev and Lauren Smith, really for your invaluable support and guidance. And before I hand it over to, I think it's Lauren, you and Della starting, I want to extend my sincere thanks to Wendy for everything Wendy does, but also to Amy Abushanab. I mean, she truly coordinates this program. She puts a heart and soul to this, and every bit of success of this program is really thanks to Amy. So thank you, and Lauren, yours.
Hi, everyone. I'm Lauren Smith. I am Associate Director for Research Operations at the Lurie Institute, and I also manage several of our NIH studies related to sexual and reproductive health and pregnancy in people with disabilities. I had the opportunity to work with Del Abney for the fellowship. Del is a graduating senior with a double major in psychology and women's gender and sexuality studies. And after graduation, Del will continue to work with us for a few weeks and then head to University of Chicago to pursue a master's of social work. Del, I want to thank you for all your work over the last 2 semesters, for your thoughtful questions and bringing your perspective to this study. It has been great to work with you, and I am very thankful to have you for a few more weeks. And congratulations on the fellowship, graduation, and on University of Chicago. Here, and your notes. That's what they're saying.
Hello. I am Del Abney. As Lauren said, I'm a graduating senior this year, double majoring in psychology and women's gender and sexuality studies. I also have a minor in English. The main reason that I was drawn to the Lurie Fellowship was the focus on community-informed and integrated research, which I'll talk more about later. Um, some of the things that projects that I worked on over this past year. Um, First project was Association of Sexual Education with Condom Use at First Sexual Intercourse among adolescent and young adult men with disabilities. For this project, I was able to begin the literature review and introduction for this paper. We used national data from the National Survey of Family Growth, and our preliminary findings found that this population is less likely to receive sexual education on several categories of topics that we broke down for purposes of the study. They're also less likely to use condoms at first sex. There was a small association between these two findings, but for our next steps, we will continue to do individual topic associations to determine what strongest correlations there are, and do analysis for associations by type of disability.
Excuse me.
Sure.
This is obstructing. I'm just trying to drag it.
Yeah. The first study that I worked on, I actually got to start over the summer, last summer, for a study on disabled Black and Latino women pregnancy and birthing experiences. My first project at Lurie was reviewing the transcripts for these that we outsourced, and then reviewing for accuracy and consistent de-identification. The main project that I've been working on has been sexual and reproductive healthcare barriers for young people with disabilities. For this project, I've been doing the same work of reviewing transcripts, but I've also gotten to conduct interviews with our participants, which has been a really amazing experience. The purpose of this study ultimately is to create an online toolkit to fill in the gaps of the kind of education and resources that this population is lacking. So being able to conduct interviews with participants has been really impactful, and being able to hear how much the project means to them and their personal investment in helping to create and give it their insight into what kind of things they want to see, how they want to see it, and what would benefit them personally. I've also been working with the analysis team for this project to create the qualitative code book. And we'll be continuing to code, do the analysis, and build the toolkit over the summer. I wanted to talk about how Lurie has shaped my future plans here. As I entered my undergraduate career here, I was pretty sure that I was going to go straight into just clinical psychology. As I took more upper level psychology classes and also took more classes such as Dr. Mitra's, I realized that a lot of ideals held by psychology aren't very compatible with the ideals that I hold with disability justice. Um, I think working at Lurie has really helped me to understand the kind of work that is possible to do with the disability community and prioritizing the kind of support that they want and need. Um, the codebook project, the toolkit project that I talked about last is just one example of the kind of dissemination of research that we do at Lurie. We're really focused on making sure that our findings get back to the community and really benefit them. My experience at Lurie has modeled community-based research in ways that I had never seen before or even knew were possible. It's given me a foundation to continue prioritizing and involving the communities that I want to serve and allowing me to continue my academic career at the University of Chicago next year with confidence. Lastly, I just want to say thank you to everyone that supported me in the fellowship, to Lauren for excellent mentorship, infinite patience and support with all of my questions, Janelle and Ian for helping to train me in the middle of a research project and also taking the time to do all of that for me, Monica, Amy, Ruby, and everyone else that coordinates all the behind the scenes work and makes the fellowship possible, and to all of my peer research lawyer fellows for public problem solving support and commiseration. Thank you.
Our next presenters are Ilham and Randy.
Hello, everyone. My name is Ilham Sharif. I'm Senior Research Scientist at Lurie Institute and also Research Director. Currently is second year graduate student at Harvard and will be graduating this May. I associate with Karani such terms as perseverance / determination and consistency. I recall first time we met via email when she sent me an email asking if Lurie had an opening for any GRE position. And she said she was referred by one of her professors who knew her interest in disability justice, and also she knew Lurie Institute. Those of you who are here definitely use this approach. It works. At the minimum, we felt obligated, to interview her, since our colleague, who knew her and knew us, referred to each other. We interviewed Karani, and Frank is here to second that we really liked her, but the competition was very tough. So we hired a PhD student with advanced quantitative skills. But lo and behold, Karani applied for the Lurie Fellowship, and our path crossed again, and she became one of my mentees. By now, she's an advanced user of Stata and analyzed complex data such as hospital discharge records with multi-million observations. She found multiple bugs in our codes. Again, Frank here to second this. So thank you, Karani. She also a proficient user of R, which I can't use. Another important analytical tool that she learned by herself. And this is only because I said, I didn't want us to learn how to create forest plots. And I heard that R is really good for this. Again, lo and behold, she produced one of the best plot I've ever seen that we use for our publications now. But this is, of course, up to hundreds of iterations. So thank you. And without further ado, I'll pass the floor to Jeremy.
Hi, everyone. Use the arrow keys.
Hi, everyone. My name is Kieran Belvin, and today I'm going to be talking to you about my time as a 2026 Lurie Graduate Research Fellow, spending my time working with ILHOME and working on intellectual disability and the risk of COVID-19 death in U.S. hospitals. So a little bit about me. I'm originally from Texas, but as Wilhelm stated, I have been a graduate student at the Heller School for Social Policy, studying economic and racial equity as my concentration. But I have a background in political science, and I worked 3 years as an ABA instructor working with children with autism. And I have a passion for disability justice and advocacy. Something that what drew me to Lurie was definitely their research. As a student on campus, I had become familiar with some of their publications on sex education and advocating for reproductive rights for people with disabilities. And I knew as soon as I found out about the opportunity that I would like to challenge myself to especially grow in quantitative analysis. So I applied. And one of the things that I really am inspired by the Institute is their dedication to raising the bar and pushing for people with disabilities like myself to continue and thrive like our peers. So a little bit about the research project that I worked on. Me and Ilhom encouraged me to start reading up on the data set that we were utilizing. And something that we utilized was the Healthcare Costs and Utilization Project. Within this project, I was curious about COVID-19 death and looking at how it affects people with disabilities. And so me and Ilhom, with his enormous help, we started to dig deeper and we started pulling hospital visits from the data set from March through December, looking through using ICD-10 codes to identify patients with intellectual disabilities and COVID-19 hospitalization and death. And one of the questions that we tried to answer is, are adults with intellectual disabilities more likely to die in the hospital after COVID-19 diagnosis compared to adults without ID? And I wanted to bring up a data visualization that Ilhom referenced, which was the forest plot that I taught myself to make in our studio. One of the things that I wanted to explain is that basically a data visualization is just like a visual representation of data and information. And one of the things that it shows, as you can see, where intellectual disability is ranked, it's despite being young and despite having less health, health, sorry, despite having despite not having well-known COVID-19 risk factors such as obesity, diabetes, and chronic pulmonary disease and other, et cetera, other things, intellectual disabilities still ranked at a 2.21 higher risk for COVID-19 and hospital death. And as you can see, it's blown up more, so you can see that more clearly. It was really cool to begin working with the data because I was unfamiliar on the subject, but after conducting a comprehensive literature review alongside Ilhom, we found similar studies on the subject, but it wasn't nationally representative as ours. And what's cool is that we got to submit the manuscript to the Disability Health Journal with Ilhom as the first author, me as the second author, along with Monica and others from the Lurie Institute. And in the research project, we discussed more of the risk, but today I wanted to discuss more of the implications because they're as important. And as we noted, patients with ID are more than twice as likely to die from COVID-19, but this raises questions about the experience of patients with intellectual disabilities within hospitals. A significant barrier to advocacy during the COVID-19 pandemic was the communication challenges faced by individuals with intellectual disabilities. I myself had an aunt who had ID that passed away during the COVID-19 pandemic because she didn't receive a support system that she was usually attended to while she was in the hospital due to structural challenges during the COVID-19 pandemic, limiting the support of persons during that time. And so combined with the communication difficulties and cognitive impairments and lack of self-advocacy, it raises questions about medical ableism within the environment that is implicitly or explicitly devaluing the lives of patients with intellectual disabilities for some of these key life-saving interventions, such as we looked at the sequential organ failure assessment, which is assessing survivability, but this doesn't take into the fact the individual consideration of how disability might affect that scoring. And so, in conclusion, we want to explicitly include individuals with intellectual disabilities and all disabilities in pandemic preparedness in the future. And so we're looking into crisis standards of care protocols and looking into including them into public health communications and making sure providers have disability competency training. And so I really enjoyed my time at the Lurie Institute because as a Lurie student fellow, I've been able to grow in these different research skills, strengthen my writing, and it's helped expand my career search because I definitely want to continue working in research. And it's also helped connect me with more students like me, like my fellow fellows. So thank you to Amy and to Ilham for being awesome mentors, and to Monica and the entire Lurie Institute for supporting this awesome journey.
Hey, Ella's next.
Hi, everyone. I'm Miriam Hyman. I'm a researcher at Lurie. I am delighted to introduce Ella Chase. Ella is a graduating senior majoring in psychology and HSSP, and it was a pleasure working with her this year. Ella, you are an incredible asset to our project examining positive parenting experiences for mothers with IDD. She was always eager to learn new methodologies and at the same time, very happy to pitch in and help wherever help was needed. I especially appreciate how thoroughly you analyzed our data. She really made sure that we highlighted and elevated the strengths of the interview participants. I'm so glad that we can continue our work together this summer. I know that Ella's diligence and enthusiasm will keep us on track. So, Ella.
Hi, everyone. I'm Ella, and I'm one of the undergraduate research fellows for the Lurie Institute this year. So a little bit about me, like Miriam said, I'm a graduating senior in May, majoring in psychology and HSSP with a minor in journalism. And then just a little bit about why I originally applied to the Lurie Fellowship. It's just because I've been passionate about reading and also being a part of research that really centers people's lived experiences, kind of treats them as the experts, and is like really community engaged. And I felt like the Lurie Institute really aligned with that mission. And I worked with Miriam. So the main study that I helped with was called Positive Parenting Experiences for Women with Intellectual and Developmental Disabilities. And this was a strength-based study. So two of the main goals of the study was to explore positive parenting experiences among women with IDD, as well as identify internal and external resources that they use. So internal being character strengths, which I'll get into that a little bit more later, as well as external supports, which will eventually inform positive, supports that amplify off of their strengths. And then just the importance of the topic is this is a understudied and underrepresented group. A lot of past research has focused on like a deficit framing, focusing on what people can't do. However, this work really elevates what they can do and their strengths. And then just a little bit about the methodology. So it kind of started with interviews with 9 participants, which was all conducted by Miriam. And she would ask questions in a way that would elicit positive parenting experiences, which either she would say, "Oh, that sounds like blank," one of the character strengths, which I'll get into later. Or my job was to kind of code for them and notice them, after the fact when I was coding it in the actual transcript. And this was all done in Atlas after the fact. So yeah, like I said, the first job was kind of cleaning transcripts, which was like making sure that the audio recording matched up to the transcript. And then I would code for a variety of things. On the right, you'll see some of the character strengths that we coded for. This is using the VIA model, which includes so many different character strengths which we coded for, as well as coding for positive parenting experiences, as well as those that were shaped by disability. And then also maybe where there's some disability related challenges. And then a little bit about initial findings, because now we're kind of in the process of writing up the manuscript. One thing that I was able to help with was making an APA demographic table, which I've never made before. But on the right, you can kind of see, the different demographics of our participants. I guess so. It was cut off, but I promise it was there. There were 9 people in total. And I remember that there was 6 people who had 2 children and 3 had only 1 child. And yeah, I kind of just broke it up by these demographics. And then on the left, because I was helping with the introduction as well as the results section, this is just one quote from the results. Because 2 of the results parts that I'm working on is how in the study, there were numerous positive parenting experiences among all of our participants, as well as some of which were shaped by disability. So one quote that I really loved, there were so many amazing quotes that show positive parenting experiences, but one that I wanted to use as an example. This is a mother talking about her relationship with her 6-month infant. And she shared, "But what amazed me was how quickly we could adapt to each other. She realized that it was easier for me to pick her up if she stiffened her whole body. And I was like, oh my gosh, she's stiffening her whole body." So just reading that, I would kind of read it and think about the kind of relationship between the 2. It sounds like teamwork. So I would code for teamwork. That's definitely a character strength of the mother, as well as social intelligence, being able to kind of recognize, what her daughter is doing for her. And then just love, she shared, "Oh my gosh, she's stiffening her whole body. She sounds happy and shows lots of love." So I would code for that. And then kind of like I mentioned previously, some of the gaps and broader issues is that research on parents with intellectual and developmental disabilities often uses a deficit framing, which is why strength-based kind of like looking at where parenting experiences are good and where the strengths are in this group, and kind of like elevating off of that to create support systems is really important. That's also just why it's important, like for it to be qualitative research, because we can literally code for different quotes and just get a good sense of their experiences. And yeah, this is just supports that will improve mothers' day-to-day life and day-to-day parenting, as well as well-being. And then just some of the other responsibilities I helped with. So we submitted to the APHA conference. I wrote up an abstract, which we submitted and presented in November. Like I said, we're currently working on the manuscript, and I also helped with writing 3 plain language research briefs. So this is basically peer-reviewed journal articles, and I would turn it into accessible plain language for general non-academic audiences. And then over winter break, I helped with conducting nationwide outreach to advocacy organizations, which basically just meant emailing them and telling them that hey, we have a data dashboard that kind of shows breakdown about termination of parenting rights and stuff like that, and kind of telling them that it's there and that it's a resource for different organizations. So to kind of sum up, because of my experience as a Lurie student fellow, I definitely built confidence in pursuing a career in health and social policy. Not totally sure what I want to do, what the end goal is for me, but I definitely love research, and especially in this realm. And then I've always been familiar with the term strength-based research, but I really got to be a part of the methodology, and I truly got to experience what that meant, and just how much I loved it. I also learned how to make research more accessible to non-academic audiences. I've never had experience turning something that was very academic into something more non-academic, so that was a great experience. I also got to write my first conference abstract for submission, and then also just got to deepen my connections with so many amazing other fellows, staff, and other researchers. And looking ahead, hope to maintain these connections as I pursue my MPH at Columbia University Mailman School of Public Health next semester. So yeah, thank you. Thank you.
Lauren.
Right. Hi, everybody. My name is Kim Tae, and I'm also a researcher here at Lurie. It's my pleasure to introduce Lauren Farley. Lauren is an anthropology major with minors in environmental studies, education, and theater. Lauren has been invaluable to our data analysis and paper writing processes. I really appreciate her detail-orientedness, and it really, really helped again with our data analysis. Um, Lauren, it's been a pleasure to mentor you this year, and I believe you will go far. So, without further ado, Lauren.
Thank you so much for the introduction, Kim. So, hi, my name is Lauren Farley. I was just introduced by Kim Tae, who's been my amazing mentor this year and also was lovely enough to run an independent study for me in my last semester, really focusing on disability studies alongside our research in that I'll get into in a minute in the direct care workforce area. But Kim has been such an amazing mentor, so I just want to start this by saying thank you to her. So a little bit about me. I'm an undergraduate senior. I will be graduating in May. I am majoring in anthropology, minoring in education, environmental studies, and theater. And my main kind of why Lurie was I have a very deep interest in disability culture and community, and particularly the disability research by disabled people, kind of nothing about us without us principle, and a personal connection as well. And the fellowship was recommended to me by a professor my sophomore year. Thank you, Professor Stephen Gully, for letting me know that this was even a possibility. So moving on, I worked on two main projects, kind of almost split up over one per each semester that I was with Lurie. And I worked on a direct care workforce study and then also a study looking at transitioning people of color out of nursing homes and into the community, specifically from the provider perspective. So starting with the direct care workforce study, the goal was to understand the experiences and perspectives of direct care workers, particularly strategies to improve recruitment and retention, because of the large direct care workforce shortage that there is right now. So the very, very general brief research methods were qualitative research via interviews and thematic analysis. And so I joined the project at the point where the interviews had been done and we were working through coding and working on the code book, using Atlas and kind of coming up with the themes and figuring out where the codes were going to go. And so our initial findings were that there is a lack of financial and other job support for direct care workers, particularly hours, benefits, and pay were some of the major challenges that direct care workers face in finding or maintaining a job, and kind of why this research matters. One, it helps us better understand the direct care worker shortage. It helps us better support direct care workers. And it also will eventually benefit those utilizing home and community-based services. So rather than being in an institution, getting the support that they need for their disability within the community in their home or centers for independent living, things like that. So HCBS, meaning home and community-based services. And then the second study that I worked on was transitioning people of color out of nursing homes. And this was also looking at home and community-based services. And I joined at the point where we were looking specifically at provider perspectives. So there were kind of two sides of the study, one looking at the experiences of the people actually leaving institutions and moving into the community, and then one looking at the kind of provider perspectives of what that process looks like. So the goal was to qualitatively explore provider views on the barriers and supports that disabled people of color experience in getting out of nursing homes. And the main research question was based around those barriers and supports, specifically for disabled people of color. So this was a very similar kind of idea with the qualitative interviews and thematic analysis in terms of the overall research methods. And then I joined at the point where codes had already been developed. There was a lot of thematic analysis already done. And so I have helped write and find sources for the results section, literature reviews, and as Kim kind of mentioned, being very detail oriented, I have done a lot of kind of general editing of the manuscript, going through and cleaning and just sort of pulling things together. I like to say that I've been lurking in the manuscript document. So some of the initial findings were about access to healthcare, transportation, technology, and the getting access to personal care assistants, direct care workers, and the cultural competency of those direct care workers. So that kind of talks about, there were a lot of conversations with participants about ideas related to what was important in a direct care work, in a direct support worker for them, whether that was having somebody who understood foods that they liked, or that their religious community, or just even things such as family support. So cultural competency is one that we had particularly focused on. And in particular, barriers that we found were housing, social isolation, understaffing, and that lack of cultural competency, which was due to a lot of different factors, particularly including that ties really well into the understaffing and not having enough support workers to adequately support everyone. And also housing both falls into like actual accessibility of not having that accessible housing for people with disabilities, as well as, given the current housing market, just the lack of affordability in general. But then we also saw some really important supports, including programs and services, such as the program called Money Follows the Person, which really helps in transitioning people out of nursing homes, and also centers for independent living, providing a lot of support as well. And then social activities, just getting out into the community, and care networks and family support provided a lot of help for transitioning people of color out of nursing homes. So this matters because it helps combat institutional bias, which where the medical institution and like general, I lost the word there, but the general kind of policy prefers to put people into institutional settings rather than help them live in the community. So we're helping combat that bias towards institutionalization. Also helps strengthen home and community-based services by showing the importance of them, and also identifying barriers and supports in an underserved community. And in the end of the manuscript, recommending policies that could help improve the transition of people of color out of institutional settings. So both of the things that I worked on kind of looked at social policy issues related to direct care workforce and home and community-based services, getting people into the community, really kind of building community and culture. And so there's just a couple of Lurie images here kind of talking about what home and community-based services and supports are. But I don't want to spend too much time on that. So kind of my time with Lurie has been such an amazing experience, and has really helped me shape my goals for the future. Particularly, I would love to continue working in disability research and or policy advocacy education, particularly working with the disability community and community engaged practices. To echo Amy earlier, I would really love to keep in contact with the people that I've met at Lurie. This has been such a great experience. And I'd love to travel and learn more about disability in international contexts. I studied abroad in Ireland in my junior year and learned a lot about disability in kind of a more European context. And so I'd love to kind of expand that. And finally, my main goal is to find a way to combine my interests in disability culture and community, education, sustainability in the built environment, storytelling, and the creative arts. I like to say that I have a lot of different ideas and they all kind of just come together in a wide variety of ways. But I would love to find a way to kind of bring many of those together. And because of my experience as a Lurie Fellow, I've learned so much about disability policy and research. And I know now that I really want to continue working in disability research and policy, or advocacy, education, any of the things that I mentioned on the last slide. But I've had such a great experience at Lurie. Thank you to Amy and Ruby and Monica and Wendy and everyone else for really getting the fellowship together and making this experience possible. Thank you to Kim for being a great mentor and also just talking to me about disability all the time. And to my fellows for just a great experience and getting to know you all. Thank you.
Hello, everyone. I am Lauren Bixby. I'm a research scientist at the Lurie Institute, working primarily with the community living policy and equity centers. And I have had the absolute delight of working with Emma Ortman this year, who is a master's student at Brandeis in the Global Health Policy and Management program and will be graduating in just a few weeks. I just want to commend Emma on her curiosity and warmth and enthusiasm for learning about quantitative research. And I think at the start of this year was relatively new to quantitative research, but through her coursework and then also the work we've done together has kind of been thrown into the deep end. And so I am very grateful for your persistence and getting to work together and also for your trips down to Philadelphia. As I like to joke, our Lurie South campus, we've gotten to get together a few times, which has been really wonderful. So I am very excited to hopefully continue working with Emma over the summer for a bit and see where life takes her after this.
Thank you so much. Thank you so much, Lauren, for the introduction and for being an incredible mentor this year. Hi, everyone. My name is Emma Ortman, and I'm so honored and excited to be standing in front of you to present what I've learned in my Lurie Disability Fellowship this past year. Here's us. So a bit about me. I graduated from Brandeis undergrad last May with majors in Health Science Society and Policy, Anthropology, and International Global Studies with a minor in French. And this academic year, I've been continuing on with my Master's of Science in Global Health Policy and Management at the Heller School. My interest in disability studies stems from being a family caregiver of my sister Samantha. And from that interest, I've explored different experiences both at home in Dallas and abroad in Thailand, facilitating occupational therapy and physical therapy for people with disabilities. Some of my research interests include addressing barriers to accessing healthcare, autism, LGBTQ+ topics, and reproductive health. So to dive into our research, Lauren was amazing and so supportive in helping me design this project from the ground up. Our topic is a mixed method study examining direct care workforce challenges and its associations with access to healthcare, health-related outcomes, and community living outcomes.
I'll start off with some definitions so that we all know what we're talking about. So there is a direct care workforce crisis driven by low wages, limited supply of workers, inadequate training, etc. And it manifests in terms of staff turnover issues, problems finding workers, and difficulties with staff being respectful in some cases. Personal assistance services, PAS, refers to people who help you in your home with personal care or daily living activities because of your health or disability. And there's both paid PAS forms and unpaid PAS, both of which we evaluated in this research project. And then staff turnover is when the people who are paid to help you change too often. So for our project, we used data from the 2025 wave of the National Survey of Health and Disability. We focused mainly on these PAS and workforce challenges, including trouble finding workers, high PAS turnover, respect, and unmet PAS needs. The goal of the study is to identify relationships between unreliable caregiver access and healthcare utilization, mental and physical health outcomes, as well as self-care and community participation. And this research is so timely and so important because we have a direct care workforce crisis. There's more than 700,000 people on or around on the waiting list for HCBS. And on top of that, we have an aging US population and a large disability population. And so there are extensive health and healthcare implications of the direct care workforce crisis. And direct care workforce challenges are known to decrease autonomy options for people with disabilities and increase institutionalization in some cases. And so to get into the research methods, we started with a literature review and narrowing down topics of interest and variables of interest with the National Survey of Health and Disability data. Then with Lauren's help, I learned how to do data coding, and we got into the data cleaning and recoding variables. We're currently in the stage of quantitative analyses, doing descriptive statistics and identifying relationships between different variables, different demographics. And soon we'll move into the qualitative portion of our analysis, focusing on the open-ended responses about unmet PAS needs, doing thematic coding analysis and atlas. And to get into some of our research findings, looking at the big picture, 28% of PAS users experience staff turnover issues, 44% of paid PAS users report issues with finding workers, and 14% of PAS users say that their workers are not always respectful of their culture. And I wanted to zoom in on this one question because I think it illustrates a lot of the impacts felt by not having your PAS needs met. The dark blue part of the bar graph is people who have any form of PAS, and the light blue is the percentage of people who need more PAS or don't have it but need it. And so this bar graph is showing the percentage of people experiencing certain outcomes for not being able to experience Blink as much as they would like in the past 12 months because they didn't have someone to help them. So as you can see, close to 50% of the respondents have unmet needs for community activities. Almost 40% have not been able to eat as healthily as they'd like in the past 12 months or exercise. And so just as a big picture, there's massive implications for self-care needs and community living needs due to the direct care workforce crisis. And here's just a look at some of the emerging trends in our research. As the groups with higher rates of direct care workforce challenges tend to be people with annual incomes under $40,000, people ages 35 to 64, people with public insurance are 20% higher or have a 20% higher rate of having trouble finding workers and are 2 times as likely to experience cultural disrespect from their workers. and LGBTQ plus populations also experience higher rates of direct care workforce challenges. As for the impacts of these challenges and unmet PAS needs, people who experience these difficulties are 20% less likely to be employed when they have unmet PAS needs versus when those needs are met. They're 2 times as likely to experience poor mental health days, 14%, more than 14 days of the month. And there's also higher rates of moderate to severe pain and more impacted days due to poor health. So our main finding is that the direct care workforce crisis and the challenges that come with it are very common and have negative impacts on health and community participation. The policy implications for this is that we must develop policies that address the direct care workforce crisis to reduce unmet needs and mitigate consequences of this crisis on people's well-being. And the next steps are to finish the quantitative and qualitative analyses, and then Lauren and I plan to write a research brief or journal article about disparities in direct care workforce challenges and its association with health and community living outcomes. And so here are some of my takeaways from the fellowship as a whole. I'd like to say a giant thank you to Lauren, Amy, Maddie, the Lurie community, and all of my fellow fellows. Because of this experience, I gained so much more experience with quantitative research skills, more confidence and understanding about how research projects get developed, starting with just a data set, research questions, and now a whole project, and eventually in the summer we'll develop a research brief. I've also gained a network of the coolest professionals and a greater understanding of disability policy, institutions, and health, as well as new friends. Thank you so much.
Good version.
Hi there, I'm Sid Pickern and I work with the Community Living Policy Center here at Lurie, and it's a pleasure to introduce Bipasha Roy, who is a master's student in Sustainable International Development at Heller. And although I didn't have the opportunity to supervise Bipasha, I did read her fellowship application materials and knew immediately that this is someone with a deep passion and commitment to growing disability research and policy. Mary Lou Breslin from DREDF, or the Disability Rights Education and Defense Fund, who couldn't be here today, did supervise Bipasha and shared that Bipasha is an eager learner who's enthusiastic about understanding the context in which the research topic resides, who's openly willing to share her related or adjacent experiences working in the education sector in India, and no matter where Bipasha's education path and career journey lead her, she will be a great asset to this field. So thanks so much, Bipasha.
Thank you so much, Sydney. Hi, everybody. The first thing that I want to say is thanks to all the people who worked on the topic, source of income discrimination at the intersection of disability. I would like to thank Mary Lou, who I meet every week a couple of times, and David Ken, who used to work on this project as well and has been a huge, I would call him a mentor at this point to me as well, and Sid Pickern for coordinating the fellowship for me. So I would like to thank them. I am a master's student, as Sid mentioned, My focus has always been in working in the education system and disability policies. Before, my interest in this work comes from my background growing up in Jharkhand, in India, which is one of the eastern states, where I saw how structural barriers shape access to opportunities in order to live life with dignity. What is source of income discrimination? Source of income discrimination refers to when landlords refuse tenants based on how they pay rent, most commonly through housing vouchers. When this intersects with disability, the barriers become even more severe. Many individuals not only face stigma around the voucher use, but also struggle to find accessible housing. And despite legal protections, access is still limited in practice. And as one of the attorney spoke to put it, I only see when it doesn't work. In the project, we focused on understanding how source of income discrimination intersects with disability. While legal protections exist, we wanted to understand why these barriers continue to persist in practice. Through our interviews with different lawyers and practitioners, one thing became very clear. The goal of advocacy is not just the legal success, but real access as as the real access. In order to speak about the methods, we worked with qualitative data mostly, including interviews and case materials, and used coding methods to identify patterns and recurring themes. I would also like to thank Lauren, who trained me on the platform that we use, Deduce. So I'm very grateful to her because she made it very easy for me to understand how to do coding. What were our key findings? A few of the key findings stood out in our research. First, enforcement systems are often too slow and difficult to navigate. While tenants can technically file complaints, the process takes time, often weeks or even months, whereas housing searches are extremely time sensitive. As one of the attorney explained, by the time you get anywhere in the commission, that unit is long gone. So in many cases, even when discrimination occurs, people don't pursue enforcement because they need housing immediately. Second, we found that discrimination often happens indirectly. Instead of explicitly refusing voucher holders, landlords rely on criteria like credit, and they try to exclude in different forms. So in ways like asking for triple rent. So for individuals with disabilities, which becomes impossible for people sometimes to arrange, and of course they don't get the unit. Third, administrative burdens discourage landlord participation. Processes like inspections, paperwork, and delays in approvals can make voucher programs less attractive to landlords. This reduces the numbers significantly in the numbers of available units, further limiting housing options for voucher holders. Finally, for individuals with disabilities, these challenges are even more severe. There is already a limited supply of accessible housing, and much of it's newer and more expensive. Why this matters? Why this research ultimately, what this research ultimately highlights is broader issue, the gap between policy design and lived reality. Um, we have legal protections in place, but those protections alone are not enough to ensure access. As one of the practitioners put it, if you are just doing damages, the person still didn't get the housing. So even when the law works on paper, it doesn't always translate into real outcomes for people. What we see instead is that structural and administrative systems play a major role in shaping access to housing, from how quickly complaints are processed and to how voucher programs are implemented. And because of this, inequality often persists. I don't know what's happening. I think I lost. Anyway, sorry. Inequality often persists. Yeah, like with the arrow. Sorry, guys.
Yeah. I don't know how to get back. Oh, here it is.
Thank you. And because of this, inequality often persists through everyday practices, not just through explicit discrimination. It's not always someone saying no directly. It's the systems, the processes, and requirements that quietly limit access. Through this experience, I learned just how complex policy implementation really is in practice, even in the US. While I had engaged with similar issues in my work in India, this project helped me see more clear gaps and between policy and implementation in the context of disability studies here. And I did not really have this local context. So I want to give a shout out to the people who helped me understand that. I already had an experience with qualitative research, but this work helped me strengthen those skills significantly, especially in coding interviews more systematically and identifying patterns and connecting individual narratives to the larger structural issues. Most importantly, I learned how to critically examine systems and not just policies themselves. This experience deepened my ability to look beyond how policies intend to do and instead focus on how they actually are affecting lives of everyday individuals. This experience has further strengthened my skills in working in at the intersection of research, policy, and implementation. I'm particularly interested in designing systems that are not just well intentioned, but actually is accessible to everybody. In the near term, I wish to continue engaging in research and hopefully pursue a PhD in education and at the intersection of disability policies. Thank you. I wanted to give a shout out to everybody who has put together this fellowship. I want to thank Mary Lou, David, and Sid Pickern for helping me during the whole research. I want to thank Amy, Ruby, and everybody else, and Wendy for everything. And thanks to Eben, who is actually a friend of mine from my program, who told me about the fellowship. So thanks to everybody.